the transitions.
Okay. Hi, everyone. I am Dr. Nicole Carter with Hughes Women's Health Advocacy Institute. And today we are really closing out our discussion of Under the Skin. I don't know if you can see it. My background is blurred, so it kind of makes it weird. But Under the Skin by Linda Villarosa. And then we have our co host.
I'm DéAsia Thompson. I am a licensed independent social worker, and I am the founder of Rise Counseling Group here in Dayton, Ohio. So thanks for having me again.
Yes, you're welcome. Thanks for all of your contributions in the past, and I know today will be a good conversation. So, today we are discussing chapters 7 and 8, which are the last two chapters of the book. And we invite you to add your comments and questions in whatever you are streaming on. So, on Facebook or on YouTube. Just make sure to uh, leave us some comments and questions. All right.
All
So,
right.
so in the first chapter, the chapter 7 is discrimination and ill treatment can harm everybody. I think that's a play on words. So everybody, but then every actual body. So,
Mhm.
in that chapter, Villarosa explores the experiences of folks in Appalachia. And so I think, DeAsia, I think you have a little experience in that area, maybe like living in some other areas other than
City.
Ohio. Yeah. So chapter 7 explores how experiences with poverty and health impact white spaces, and how those are similar to the things that happen in Black communities as well.
Yeah.
So, what are your general thoughts about chapter 7 and her attempt to comment and provide some commentary on and really comparison between Appalachia and some of the things experienced within Black communities.
Well, I think that she did a good job of just highlighting the ways in which poverty can, impact um, Appalachian folk, right? So white folk that are, living in situations where unemployment, you know, which she talked about the unemployment rates being, sort of similar to the statewide and, national average, but really thinking about the fact that most of these folks are working poor, cannot afford to live even though they're working full time. So I think she did a good job in highlighting that, and then also showing that those same folks are, treated in a similar way to Black and brown bodies when it comes to other areas in healthcare, right? um, I mean, I think overall, the discussion about opioids and really how that, epidemic got a lot of attention. I think she, highlighting that was a good thing, right? Because money is, pushed in that area, um, because of, this newfound, well, I won't say new, but this sort of epidemic that's happening. But to me, I definitely think it makes me sad because we've had other health conditions and other things going on in other areas in urban communities, Black and brown folks suffering, and we don't necessarily always see the same push towards health and wellness or healing and, money put into treatment, outside of like policing. So to me, I mean, I think it makes you think, and it can be, it can be frustrating. um, but I do like that she highlighted that poverty in and of itself. We have to be critical of the systems, right? We can't just always think that it's about personal responsibility because, it's not. We have to be critical of the system. So I think she did a good job of discussing that.
Yeah. So in that chapter, she talks a lot about weathering, and that's an area that I in my MPH program actually did a lot of research on, weathering. And then when I also used to, well, not used to, I still study it, but exploring like Black feminist theories and things like that, critical race theories and critical race feminisms. It talks a lot about weathering and the experiences, or really the premature aging that specifically Black women experience in their lives due to discrimination and oppressions and things like that. And so I was happy that she brought it up because it's a very important topic. And so for those who are not familiar with weathering, Dr. Arlene Geronimus is the person who is said to have coined this term, and in coining it, she really explores the dichotomy between white experiences and Black experiences, and demonstrated that there was a vast difference in terms of that. The aging on bodies and minds, but it's often due to the stress induced by discrimination and many other things. And so often the term, as mentioned, is used to describe the experiences of Black women. But again, because it's part of this chapter, Villarosa, it tries to explore it as it relates to even men, right? Like she's having a conversation with a white man and
Thought that he was
who
like
had
70.
yeah, and thought he was 70 and was actually 48, I think he said.
He was
And
48.
and so it's so interesting. Like, so all of these ideas come up because I know, like, for me, I'm in my 40s, but like so many times people think I'm like like younger, but still the term weathering still applies because you can look at anyway, right?
Right,
And still your body is impacted and people
right.
don't see that. So so she talks a lot about poverty as it relates to weathering, and something
Mhm.
that in the research is there, but that is not the primary focus usually. And
Mhm.
so what are your thoughts on her including poverty in the weathering discussion?
Well, I mean, I think that I think that poverty just as a whole should be included in the discussion because I think from a systemic perspective, we can't we cannot separate out what causes poverty, so capitalism, things like that. We can't separate that out from race and gendered issues because there's always going to be an economic lean to everything that's going on, right? So even as she's talking about the folks in this Appalachian town, or this area, part of it is like these folks were working before. The unemployment rate is different now. They can't really afford to live right now, but we have to trace that back to like what could have potentially impacted that, right? So being in those communities where there's steel yards and there's all of these sort of like mining resources and all of that, and they've utilized those resources, and now that it's depleted, those same folks are left sort of to fend for themselves after having worked for years and years, probably, a couple generations working for years and years in those areas to like survive and take care of their families. So I think we have to be critical about the way that capitalism and just the way the system works for us to be able to live, pay for our housing, pay for our food, all of those things. We have to be able to talk about it. And I mean, a lot of folks are impoverished. And she talked about the unemployment rate being 5%, but the poverty rate being like 33% in those areas. So, like, a third of the folks can't even really survive on what they're living on. And so, I definitely think that causes stress. So I don't think that you can separate that out. And I think that, all of it is interconnected. So I can appreciate that being added into the discussion, because if I'm stressed about literally being able to keep a roof over my head, feed myself and my kids, all of those things, I mean, it is going to take a toll on me. So it can weigh on how a person physically looks and feels in their body and all the things that go along with weathering. So, but I know we use intersectional differently now than the way that it was originally coined, right? But I think there are all these intersections, and I don't think that we can take poverty out of that, because our society, the way that it's set up, is that's the way that it is. So, folks are stressed about being able to survive. It's survival.
Yeah. And I think it's an important addition to the conversation, but I also think it's important to recognize that when Geronimus brought up weathering, or coined the term, she coined that term to demonstrate that specifically Black women and white women can have the same exact like upbringing, right? Experience. They can be making the same money. In fact, like Black women could be making more, could be wealthier, can have full, like, great health care, all of these different things, access to all of the social and cultural capital possible, and still be impacted negatively when it comes to their health. And so they usually, in discussions about weathering, things like like maternal
Mortality,
mortality and infant mortality come up, right? Because that's an example of weathering in real time, right? Like the
high
impact of it.
cortisol levels. I mean, that is a thing. So when they talk about weight gain and BMI and all of those different sort of like markers of health, it's like we're also not accommodating for the fact that Black women and Black folks are walking around in this world in Black bodies, right? So, if we have higher than normal cortisol rates and we're just living our regular life, right, going to work, coming home, but we have to worry about all these other instances, it can impact our health. It can impact our stress levels, and make it hard for us to have those lower, more normal cortisol rates. Because we are under a lot of stress.
And that's why I even said like the same upbringing, because essentially it's not the same upbringing. Like, we could be part of maybe even like upper middle class families and still, right, like still be impacted by racism, microaggressions, what have you, on an everyday basis. And that ultimately impacts our health, that impacts our psyches, that, right, like it wears on or ages, right? Ages. Because weathering is just another way of saying aging, like premature aging. And so I'm so interested in this topic. I wish there was an entire book just on that, but I would read it.
You gotta write it.
Well, we gotta write it. All right. So we're going to move on to chapter 8. So chapter 8 discusses, the title is Putting the Care Back in Healthcare, and Solutions. And so I'm all about solutions, because we could talk about the things that are occurring every day, and the problems. But I think, DéAsia, you're in the business of creating solutions. And I know for sure Hughes Women's Health Advocacy Institute is in the business of creating solutions. So, and those solutions, they are difficult to enact, to find. They require innovation. They require courage in the face of really danger a lot of times. Like, and encouraged in knowing your truth in the face of things like gaslighting by doctors, by
Yeah.
professors, by whoever it might be. So like, or industries as a whole, government. So yeah, but solutions are necessary if any of this is going to change. So um, there are some things that were discussed in the book in terms of this of the solutions, but one sticks out, and I'll just mention it for the sake of the discussion. Um, but Villarosa talks about a student who stood up to her, I think it was Penn State, I believe, medical
Mm.
school. And she talks about the student who stood up to the medical, like basically the program itself, and joined forces with a student organization, um, and was able to change the way certain things are treated, or actually certain things are taught in that particular program. So that's one program though. So, but the
Right.
fact that this one student stood up um, and could have been, you know, could have been expelled, anything,
Yeah.
pigeonholed into, like, well, we're not going to, like just really making it very difficult for her to graduate
Yeah.
essentially or finish the program. But I'm trying to remember what exactly it was that the specific thing that she challenged the school about, but it was the teaching. Well, this chapter is so long because it has like all these solutions, but I will say that it also talks about um, solutions such as increasing care from doulas, things like that, making sure that and really on a policy level, which will take some time, but changing the perspective on doulas and midwifery so that this practice that really women of color have been engaged in for
Right.
all of our centuries, right,
Forever. Right.
is becomes normalized as something that um, will actually save the lives
Yeah.
of women
I
of
definitely
color.
I suggest doulas and midwives
Yeah.
wholeheartedly.
Yeah, so that particular one they talked about the Birthmark Doula Collective, and that was the one Giwa, the woman that was brought up in chapters
Mm,
prior
yes.
to
Mhm.
this one, but they focused on the significance of doulas, and then graduate students fighting back against their actual programs
Yeah.
when they have tried to teach certain things that were not. Uh, Completely untrue. I think it was kidney doing blood work surrounding
Mhm.
kidneys and
Mhm.
how African American there's a different calculation used for Black folks than it is for others who are doing blood work, and
Mhm.
how that is outdated. But so I
Right.
still see it when I look at my chart like for testing, and it's so obviously it's still used, but
I don't know that
apparently.
I ever noticed anything, but I mean, I definitely think the advocacy part for students, I think where a lot of students do struggle is because they're only in a program for a certain amount of time. And so they're trying to advocate and get through the program. Um,
Mhm.
but I mean, I'm glad that she went up against the school, right? To
Yeah.
change policy, and it can happen. I've seen that happen and know of schools that student led advocacy can change literally the course and trajectory of graduate programs. For example, the social work program that I teach in, students came together and said, we want our courses to be more inclusive. We work with marginalized populations, and so we need to make sure that it's incorporated in all of our materials, not just as an elective. And so now, they have whole foundational courses that, are built in. The syllabi have different requirements now. There has to be a certain level of marginalized populations that are, that the materials are sourced from. So making sure that we're hearing other voices and making sure that we're listening, because we, folks are telling us what they need and how they need to be cared for.
Yeah.
And it's
Yeah.
important to listen.
Yeah. Definitely. Um, yeah, I think it was Naomi Nakinsi. That was
Yeah.
one student. Yeah. And then the Institute for Healing and Justice in Medicine. So that was a whole collective that is still attempting to abandon the race correction and
Mm-hmm.
common testing in blood work. So yeah, and you just demonstrated like in real time the role of students. So those
Mm-hmm.
relate to my question. So the first one is, what are some of the solutions you believe are necessary to transform care?
Well, so on the school level, I definitely think the schools are, I mean, and that's just one part of the system. So I definitely think tackling how students are educated as they're coming into the medical field is really important. Having provided services myself for doctors and folks in the field, I've heard different things about even present day students still having outdated, stereotypical ideas and beliefs about Black and brown folks and other women of color, people of color, that are not accurate. And so generationally, maybe their parents were doctors or had family that were doctors or whatever. And so they're just kind of following, the line and, still continuing and perpetuating these outdated notions around Black and brown folks in healthcare, right? So I definitely think, systemically, we need to really rethink how things are taught, right? What is taught, even down to the fact that just recently, last year, we finally got, didn't a student design, like a Black medical student design, like a Black model, like, because we, like medical students had never seen, was it a pregnant person?
Yeah, so
I think the
there was a black student who created an entire book,
right.
but then also and then a model um, that included a pregnant person, and among some other models as well. But
Right.
yeah,
But the fact that
yeah,
that's 2022 and up until that point, there had never been books with that in it, models that look like that, that's scary, right? Because then when we're going into the doctors and we're trying to get blood work or we're trying anything, right? The thought about us maybe not feeling pain, like those things are perpetuated, right? So I definitely think on an educational level, we have to, we're going to have to improve the way that doctors and folks in the medical profession, and I'm saying that across the board, because social work, depending on what area you go into, is also still considered medical, right? For like
mhm,
what I do as therapy, we're considered a medical professional. We bill insurance and all of that jazz. So the way that we're taught foundationally has to, I mean, and I'm talking about radical change, not just like,
mhm.
oh, we're just going to add in this here or this there. No, it needs to be radical, because that's really the only way that we can really overhaul the system. But then also folks have to be held accountable for the harm that they're caused. And I think that um folks hide behind malpractice insurance, and they hide behind being well known and different things like that. And so folks should be held accountable for um the harm that they've caused in different communities and to different people. And so you know patient advocacy has to be taken more seriously. And so that folks feel empowered to even report when things are happening. Because a lot of times we hear about things after the fact, and it tends to be, a very extreme or detrimental case. And so patients have to, feel empowered to ask questions when they're going to the doctor, when they're going to be treated for anything. And then also being empowered, like if you need to report because someone has not um, acted professionally, or they're not, doing what they're supposed to be doing in your treatment, people need to know that. Because I like just sitting back thinking, I'm like, how many people fly under the radar and able to continue harming folks because people are scared to say anything or don't feel like anyone's going to listen to them. So that's also important. And then I also think that, as a whole, there's a lot of grassroots organizations that are doing the work in the community. And I think that medical professionals and folks profiting off of this healthcare system, you have to have engagement with the community, and you have to, that should be part of your responsibility. Like, don't just come into build hospitals or build whatever, like urgent care centers, like in these different neighborhoods, and then not know what's going on in the neighborhood. Like, that is your responsibility, because you have a duty to the folks that you're serving. So, I think there's a lot of different, obviously multi-level things that need to, take place. So on an individual level, agencies like mine and yours that are doing advocacy work, and then me specifically saying, this is who I treat, this is who we serve, like that's important, so folks can feel seen and heard, but then also feel empowered to ask questions and make sure that they know what they need to do when they're faced with healthcare dilemmas or having, issues where doctors aren't listening to them. But yeah, I could go
Yeah.
on.
And I think so a comment from earlier talks about and it came up when we were talking about poverty, but it still connects to what you just said, right? So the latter part of that comment was there is not enough focus on prioritizing healthcare in certain
Right.
communities. And I think also differentiating care, right? Like, so making sure that that care speaks to the community that you are like
Right.
that you are serving. And then another comment is, absolutely go into the community and reach people where they are.
Yeah.
I one of the things that I often feel is missing is particularly when you are working with communities of color. Communities of color have a history of healing practices that are often
Yep.
ignored and sometimes
Taken as
forgotten
folklore.
within our right. Like sometimes they're forgotten within our own community because they have not been shared, but also because they've been minimized by this
Right.
larger like industry. So it's just it's important in my opinion, in my view, and I know research also shows that when you focus on the strategies or implement those strategies as well, so the traditional cultural practices that exist um, within communities of color, within marginalized communities, integrate those practices
Yep.
into quote unquote traditional medicine, right? Like,
Mhm.
or westernized medicine,
Yep.
then you actually really can create some change there.
Yeah.
And that also demonstrates that you are attentive to the community. Like,
Right.
you know about that community because you've
Right.
done your due diligence to learn about those practices.
Right.
So, and I think another thing for me, and I was had a conversation with someone yesterday, and I intentionally in the work that I do steer away from the use of the term patient. I don't
Hmm.
use that term. Um, and so I use like woman seeking care or person seeking care or person needing care, because when we often think of patient, it's like right, like it's a patient in the room, and
Yep.
here's their chart, and that's all they are. They have no face. They are their illness. They are their concern, right? And that's
Yeah.
all. And so when
Yeah.
even terms like that can help transform the way that we approach care.
Right.
So I think those things are important. So the wellness practice, and then basically humanizing the people that we're caring for.
I was just gonna say that needs to be like medical 101. Like, is bedside manner, how to, like, these are actual people. They're not just numbers in a chart. They are not just your quota of surgeries or, whatever it is that you do. These are actual people. And also just even understanding how to talk to people about their care. Like, I think that there's not enough education, being done in the room because everything is rushed and everything
Mhm.
is, it's like you stack 10 patients or 10 people seeking care, right? You stacked all these folks back to back, right? And so there's not enough time to really listen to the concerns of the folks in the room. And so that makes an impact. It also impacts how we trust our providers, right? How much we trust our providers, and really thinking about, like, is this person going to listen to me? Should I even call? I mean, even the other chapter that we read, remember the lady, she said she didn't want to go to the doctor to hear the bad news because then she, was going to have to do something about it. So she waited. Even with that might have been a different situation if she had a level of rapport and trust with her provider, that she felt safe, or even felt like, even if something is wrong, I can trust that this person is going to care for me. And regardless of the outcome, I will feel cared for. Right. The other, I think people push things off because it's like, do I want to go to the doctor? And, this person is not going to necessarily, they don't feel cared for. So,
Yeah, yeah. So those are extremely. I mean, and again, so I always think about. So I have brought this up at a doctor's office before when I've had to actually go there because they would not answer the phone to refill my prescription,
mhm,
right? And so, or they answered the phone to refill the prescription, and I was just transferred to a voicemail,
mhm,
and then it had been days, right? And so you're dealing with someone who has asthma, who has, right, like if I don't have an asthma medication, I could die. So but you're taking your grand time, right, to um to respond. And
mhm,
so, but I also understand that so when I went there, because they weren't responding, they're like, we're short staffed. We don't have anyone to answer the phone. We don't
mhm.
have, like we have, it's like the same people who are scheduling are answering the phone. Like the same, I don't know. It was just a lack of staffing.
Yeah,
And so it's also understanding the industry is taxed, but
yeah,
at the same time, you stepped up to care for people.
mhm.
I don't know. I don't know. Like, I don't know what to tell you. Like, like it's a difficult,
Yeah, it's a
it's a
difficult place to
difficult
be in.
situation, but you're also a large network that, or you're part of this larger network. And so it's almost like people's lives are on the line. And
Well,
so I don't
a lot
know.
of times they are on the line,
Yeah,
depending on what's going on. It is
yeah,
a person's life
yeah.
on the line. So, I definitely, and I can understand folks in any medical profession being, you know, kind of overworked and all that. I think COVID. I mean, we were already. I mean, it wasn't perfect before COVID, but um, I think after COVID, part of it is we did lose a lot of people that were actually in the
Hmm.
medical profession trying to help,
Yeah.
other folks. But I think that could have been a wake up call for us to overhaul and figure out what we needed to do differently within this system, figuring out how we can prioritize care and not profit, right? And so
Yeah.
um, it's, it's systemic. Once again, you can't take the money out of it, right? So just like we talked about with the weathering and talking about poverty and all of that, like there's always like the economy and economics is always going to be a part of that. And it drives so much of the way healthcare is managed right now.
Yeah.
Um, so that on top of being a person of color or, even having any other marginalized identity, right? Um, it can impact that
Yeah.
negatively.
So we have some comments. And so one says there's a major difference between being heard and listened to. When you are
Yeah.
heard, at least in my opinion, is yeah, I acknowledge that you said something. Listen to, again, in my opinion, is that you what you are saying is being taken into consideration and digested by a medical provider. Yes, like
Yeah.
yeah, heard and listened. Um, and yeah, so that's important. Actually acting on the things
Mhm.
that you have heard from the person seeking care. So and then the other comment, there's not enough of this understanding, especially with people who have chronic illness or invisible illness. It gets overwhelmingly frustrating when you are saying how you feel, what you are going through, and it's not being received. and
Mhm.
and I would like so mental health, that's also an invisible illness, right? That invisible component of things. And I think we talked about this the last conversation, or maybe two 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 conversations ago, I don't know.
Mhm.
But like just the like it's already difficult for people to hear you and listen to you when you have an invisible physical illness,
Mhm.
right? But then when you have this mental illness, and there's so much stigma associated
Right.
with the mental components of them, like mental and emotional health, like or in and really it's not the health, it's the mental and emotional illness or diagnoses. um it's like a no, that's not what no, we're not talking about that.
And
And so
And the other piece to that too is that it's often separated from physical health when
mhm,
it really is together. I mean,
yeah,
if you aren't feeling well mentally, you feel that in your body and vice versa. Sometimes when you
yep,
don't feel well in your body, it takes a toll on your mental health as well. So there to me there's no separation in that. And so also I think I mean, I'm specifically like in mental health. And so, when we partner with doctors and collaborate and, try to um, make sure like they know that we're treating, that, we have this person in common that we're both working with and like all of that. Oftentimes we won't hear anything back or, whatever. And so I do get that, folks are busy and all of that. So they may not have time to take a ton of meetings and all of that. I fully recognize that. But I definitely think that there needs to be more integrative care so that folks can get both of those needs met. Because
mhm.
I mean, I know folks that work in like renal social workers, so they're working in like dialysis clinics because after a while they're like, oh, people who need dialysis tend to be depressed. You think like it's a major health condition, right? So then they're integrating social workers into those spaces physically to be able to work with folks receiving dialysis. But then once again it becomes about the money and how can we bill for this and can we do that. So it's almost like if we can't bill for it, then you don't want to put a ton of effort into it, right? Or a ton of work into it. But that might be the difference between someone being suicidal or not when they are chronically ill and in pain all the time, right? So
In my
having
opinion, not to be like morbid, but how you go build for somebody who's not here anymore because they they were suicidal and you didn't
yeah,
help them.
Yeah.
you're really not going to be able to build for them then. So can we please treat people as human beings who
Right.
have, like, as was mentioned, mind, body, spirit, mind, body, spirit connection, who have this, you know, like these needs that are whole body, mind, spirit needs. Like
Right.
they're not just the dialysis treatment.
Right.
Like,
And asking how people are taking care of themselves in other ways. And I think, folks, now I will say a lot of doctors will now do the PHQ-9 to assess for, to see if depression is present, or do the GAD, which is for generalized anxiety, to assess, whether a person's, has anxiety, or, those kind of things. So those screenings and things are being integrated, but we definitely need a more, I don't want to say aggressive, but more of an integrative approach where folks can, have those needs met. And, you know, also really, to visually see folks that can help you on either end working together, I think, would be helpful.
yeah, yeah. So the last question still connects to this, and it's specific to you. So, what are ways that you believe that you are transforming care?
So I would say, I think when personally, when I was forming the practice and when I went into private practice, um, I had been looking for a therapist, and I was like, I can't find nobody. It was, it was hard. It was difficult for me to find somebody. So, I was like, okay, so there aren't very many of us here. So I'm going to have to figure out something if I could do online or whatever. And this was like before the whole, before COVID and online therapy sort of like blew up more. Some people were doing online therapy, but I did happen to find someone here that I could see face to face. But then with COVID, everybody had to adjust. But I think my own search for care led me to wanting to have something for other Black women. And so I think that's where I had to just, say like, okay, I'm specifically working with, our primary population is Black women and teen girls and other women of color. Like I had to just stand on it. And I think even hearing that, a lot of our folks that we work with were like, look, I've never heard a provider be able to, say that. And I got some pushback. Like when I first started, even just having Black women on my website, I was told like, you're not going to have any clients. You're not going to, but I think wanting to create a space where they feel safe and feel like they're going to be listened to, right? So heard and listened to, and that we're, have somebody in their corner to help them work through things. I think that for me, that was a good start. And so, in addition to doing, individual therapy, we also do community outings. So we'll go and train or go and talk about different mental health issues, and whether it's like professionals or whether it's folks that just are in a community that want to learn about things. So I was always, when I first started, I was like at every community fair that you could go to. I was setting up tables and just talking to people and really getting not necessarily just a word about the practice, but I think really getting out there about it's important to take care of your mental health. Black folks, brown folks, we can go to therapy, right? We can sit on somebody's couch and talk to them and work through our issues. We can work through our traumas. And I think just talking about it and being unapologetic about it is where I come in transforming care, because I think a lot of our folks that we've worked with historically, they were like, look, I never been to therapy. Never thought about therapy. I only thought it was for white folks. I only thought it was for folks that are, they'll say crazy, but like folks struggling with like serious mental illness. So having very specific stigmas around mental health. So really changing what that looks like, and really also changing what it looks like to prioritize yourself. Um, so that's what I'm doing in my little corner of the world.
Okay. Okay. And of course, I asked that because, well, so DéAsia is also a provider that's listed on the directory for Hughes Women's Health Advocacy Institute. So if you ever want to get in contact with her, of course, you can go find her. She's all over. If you Google, it pops up, and in a lot of areas, because she has done her due diligence to make sure that her name is out there so that you can receive care if you need it. So, but she is also listed on the directory for Hughes Women's Health Advocacy Institute, which is on our website. So, I want to thank you, DéAsia, for that was our last question, y'all. So I want to thank you, DéAsia, for contributing actually to every single discussion for this particular book. Yeah.
It was such a good book. It was a really good
Yeah.
book. I did enjoy
It
it.
is. So we have some options for our next book. So for Minority Health Month in April, we will be kicking off our second quarter. So we do a book discussion for those watching each quarter. And so this was our first official book discussion. So in April, we will be doing another discussion. We're still working on selecting that book. And actually, I'm going to have a survey or a poll on the website. So, and post it on Instagram and Facebook. So if you're interested in contributing to the discussion about which book we should pick, you have an opportunity to do that. And so that will be listed soon. Also, make sure to follow us on Facebook and Instagram and YouTube. We need some more YouTube followers because we have to change the YouTube page. So if you have not yet followed us and subscribe to us on YouTube, make sure to do that. So thank you, DéAsia. That is it, y'all. Thank you for posting comments and watching and loving and showing us all the emojis and the the responses. All right.